hematopoiesis, and hence extramedullary hematopoiesis is expected in the primary myelofibrosis. Usually occurs in the older patients, just like above 67 years of age, and you can expect that fatigue, weight loss, and night sweats in these patients. So when there will be extramedullary hematopoiesis, one of the common finding on the physical examination is the massive splenomegaly. So the patient can present with upper abdominal pain or early satiety because of spleen is compressing the stomach. You can also expect hepatomegaly or lymphadenopathy. There is another term which needs to be defined is the leukoerythroblastosis. So leukoerythroblastosis is basically an inappropriate release of cells from the bone marrow. So they are usually immature erythroid and granulocyte precursors in the blood. So that term is known as leukoerythroblastosis, and it is also expected in the primary myelofibrosis because the immature cells are releasing from the bone marrow. Clinical features are usually normocytic normochromic anemia, and it's a severe anemia, maybe less than 10 gram per deciliter of hemoglobin. White blood cells and platelets are variable. You can also expect myeloblasts on the peripheral smear, and again the high cell turnover leads towards the formation of gout. And the treatment of primary myelofibrosis is simple stem cell transplant, and without stem cell transplant you can't treat this myelofibrosis. One of the characteristic findings of the myelofibrosis is the teardrop cells, because the marrow is fibrotic. So when, for example, red blood cell is moving out from that bone marrow, so it will convert into a deformed shape which is known as teardrop cells. So teardrop cells is also known as dacryocyte, which is a classic finding of myelofibrosis. Now we will discuss about Langerhan cell histiocytosis. So first of all, we will define the term histiocyte. So histiocytes are a category of leukocytes that occur in many tissues throughout the body. They are derived from stem cell precursors and differentiate into cells of monocyte macrophages lineage or dendritic cell lineage. So histiocytes are derived from the stem cells precursors and can differentiate into the monocyte macrophage lineage or into the dendritic cell lineage. So you can say that histiocyte is basically a connective tissue macrophage or dendritic cells based upon its differentiation. Then the term histiocytosis. So we have discussed the term histiocyte, that it's derived from the stem cell and its fate can be decided based upon the differentiation of its cell either into monocyte macrophages lineage or dendritic cell lineage. Histiocytosis is basically proliferation of histiocytes. So proliferation of histiocytes, or you can also say proliferation of macrophages monocyte lineages or proliferation of dendritic cell lineages. Now what are Langerhans cells and what are dendritic cells? Let us briefly discuss about these cells. That dendritic cells are professional antigen presenting cells that play a crucial role in activating adaptive immune response. In contrast, Langerhans cells are a subset of immature dendritic cells that reside in the epidermis of the skin. Langerhans cells are distinguished from other dendritic cells by the presence of that characteristic cytoplasmic organelle known as Burr-Beck granules. So Langerhans cells is, you can also say that it's equivalent to like dendritic cells, but they are immature dendritic cells, common in skin and connective tissues. They are antigen presenting cells. They will consume antigen, migrate to the lymph node and present antigens to activate the T cells. So Langerhans cell histiocytosis is basically a clonal proliferation of dendritic cells, and these are cells of origin of myeloid cell lineage, and the surface marker it will express is CD1A, S100 and CD207. So Langerhans cell histiocytosis, as we have said, that histiocytosis is the proliferation of the histiocytes, which can either be monocytic macrophages lineage proliferation or dendritic cell proliferation. So Langerhans cell histiocytosis is clonal proliferation of the dendritic cells, but these are the cells of the myeloid origin and expressing the surface markers CD1A, S100 and CD207. And Burbeck granule is the characteristic finding, but it's only seen on the electron microscopy in the cytoplasm of the Langerhans cells. So Langerhans cell histiocytosis most commonly occur in children, can involve any organ, but most commonly are found in bone and skin. So basically it's a spectrum of disease from rapidly fatal to less severe disease, and there is also an intermediate category of this disease as well. So one of the disease which is not fatal, it is known as eosinophilic granuloma, which is mostly found in adolescents where there is no skin involvement, but you can expect the pathological bone fracture and you will find out Langerhans cells or eosinophils on smear. So it's a pathological bone fracture, but it's not osteosarcoma. You will not have to confuse it with osteosarcoma. It's basically having Langerhans cells and eosinophils upon finding on the smear. So eosinophilic granuloma is one of the subcategory of the Langerhans cell histiocytosis, but it is less severe. The more severe form of Langerhans cell histiocytosis is known as letter-sieve disease, which occurs in child, maybe like into 1 to 2 years old child, in which you will find out the diffuse skin rash, you will find cystic bone lesions, multi-system failure, and it's rapidly fatal disease. So if you can differentiate letter-sieve disease with eosinophilic granuloma, so in eosinophilic granuloma you will have no skin involvement, but in letter-sieve disease you will have that diffuse skin rash. And the intermediate form of the Langerhans cell histiocytosis is known as Hand-Schüller-Christian disease, in which you will find the triad of skull, diabetes insipidus, and exophthalmos involvement. So skull involvement, diabetes insipidus, and you can also find that exophthalmos in this disease. So it's a scalp lesion involving posterior pituitary, so that's why diabetes insipidus, and you will see the protrusion of eye in this disorder. And this concludes our podcast about myeloproliferative disorders.